Hi everyone, welcome back in today's video. So in this tutorial I'm going to show you how to locate difficult vein when you are taking a blood. So in today's video I'm going to teach you how to find the most difficult vein whenever you are going to perform a venipuncture, that is phlebotomy. So please, what you are supposed to do first is you have to gather all the necessary equipment. For example, you will need a syringe, so I'm going to use the 10 ml syringe. You will need a vacuum container for you to transfer the blood. You will need a 21 gauge needle for you to insert into the vein to withdraw the blood. Okay, you will need a disposable gloves for you to apply as a tourniquet. You will need a cotton wool for you to apply pressure on the area where you have given the shot. Okay, you will also need an alcohol swabs for you to clean the vein. Okay, before you start the procedure, make sure first start by introducing yourself to the patient. For example, hi, my name is Dr. Daoud. I am going to perform a venipuncture. Are you ready? So the patient should agree first before you start performing the procedure. So you have to gain consent for you to continue. Then the first step, what you are supposed to do is you have to start by applying a tourniquet. You have to start by applying a tourniquet first. Then what you are supposed to do, you have to clean the vein first. You have to clean the vein by using an alcohol swab. So you have to clean the vein first. So you start by cleaning the vein with an alcohol swab. Then what you are supposed to do is you have to wait for some seconds for the skin to dry when you clean with an alcohol swab. So you have to wait for a while for the skin to dry. Then what you are supposed to do is you have to remove the syringe from the manufacturer's packaging. Then you attach the needle into the syringe for you to insert into the vein. Then what you are supposed to do is, how will you find a vein? So for you to find a vein, you must have basic knowledge, the anatomy of veins, that is the order of blood draw. So for example, we have the antecubital vein, we have the basilic vein, and we also have the cephalic vein. So you must have basic concept of anatomy, that is the structure of vein, for you to find the most and difficult vein. So when you look at here, there is no any visible vein. So what you are supposed to do is you have to feel the vein. So you have to feel the vein first. You can also palpate or you can feel the vein so that you are able to insert the needle into the correct vein for you to withdraw the blood. So tip number one is you have to feel the vein first before you start the needle into the vein. So this is the first step you are supposed to do. Then instruct the patient for his hand to be very straight. Then I see here one vein, so this is the antecubital vein for me to withdraw the blood. So this is how you are going to perform. So you insert, so I feel here one vein. So this is how you are going to locate and feel the vein. Then what you are supposed to do is you have to insert the needle 15-degree angle into the vein. So this is what you are supposed to do. Then what you are supposed to do when you insert like that, so you withdraw, you pull back the plunger for you to withdraw the blood. So this is how you are going to perform. You pull back the plunger. So this is how you are going to find the most difficult vein for you to withdraw the blood. Then step number 2 is you have to start by removing the tourniquet. You remove the tourniquet, then you apply a cotton wool on the area where you have given the shot. So this is how you are going to take blood. Then what you are supposed to do is you have to transfer the blood into the vacuum container. So you open the vacuum container and you transfer the blood into the vacuum container. So this is how you are going to transfer the blood when you finish drawing the blood into the vein. This is how you are going to transfer the blood. Then you close the vacuum container and you label it. So you have to label full name of the patient, date of birth, gender, that is male or female, then you must also write the date when you have performed the Venipuncture. So then you take it to the laboratory for testing. So this is how you are going to do a Venipuncture and find the most difficult vein. So see you in the next video.